Hey y'all, welcome back. Today we're going to be talking about the 4 main types of colon cancer screenings that I discuss with my patients, starting from my favorite to my least favorite of the 4. There are technically a couple of other options I don't mention in this video that I just never really do or see GI or general surgery do for colon cancer screening. But if I remember at the end of the video, I will give them an honorable mention just so you do know they exist for being thorough sake. So if you are someone who maybe you're in your mid-40s and you're wondering, oh gosh, what type should I do? It kind of does depend on your personal history. Are you having symptoms of anything in particular we need to be concerned about? Your family history. So if you do have an immediate family member, say a parent who's had colon cancer before, things like that. It also can depend on coverage. So a lot of my patients don't have insurance, so we try to navigate that in the most beneficial way for the patient and not give them lower quality care, but also not break the bank if they don't have X amount of dollars to spend on, let's say, some kind of screening. And I'll just throw in a couple anecdotes and thoughts here and there. If I am forgetting something or missing something, if you have any tips or experiences that you'd like to share, I'd love to hear them in the comments below. So let's get started. Let's talk about the good old colonoscopy. I'm pretty sure everyone probably knows someone who has had a colonoscopy, and I tell you, it is not the procedure that people have a huge problem with. It is the prep. So let's just talk about what a colonoscopy is. Basically, usually GI, but sometimes general surgery, and then in very rare cases, maybe in more rural areas, a primary care physician will put a camera while you're asleep through your colon, and they will look for things like polyps, inflammation, strictures, other things like that that are bothersome or worrisome. In a colonoscopy's case, say we're doing this just for screening to make sure there's no things growing or cancers there that we want to detect as early as possible. We're going to go under the assumption that this patient's not having any symptoms. They are not having chronic diarrhea. They're not having stool changes. They're not having bleeding, things like that. So for a colonoscopy, let's just say you do the prep, everything looks good, you may get the green flag to be good for 10 whole years, which is really nice. Obviously, if something comes up that's bothersome or worrisome between the first few years and we need to repeat it for a specific reason, well, sure, we can have that discussion. But if you are someone who has an immediate family history of colon cancer, or you're just above average risk, this is kind of where the buck stops for you as far as cancer screening goes. The other ones I'm going to mention later in the video are pretty much all for the average risk person. So if this is where you stop on the video, thank you so much for watching. I appreciate it. I will talk about some pros and cons here in a second, but that's kind of where we are. So some of the pros of a colonoscopy and why it is my favorite is because it is not only potentially diagnostic, but therapeutic. I say potentially, so let's just say you have a polyp in your sigmoid colon or whatever, and they need to remove it. Well, they can just remove it right there on the spot. You don't have to wait, you don't have to come back, things like that. Now, caveat in this, unfortunately, I've had a patient this happen to. You can get in there for a colonoscopy and there just be much too much to handle procedurally during that time, and they may need to contact colorectal surgery and get an actual bigger procedure set up for you as the patient. So much of the time, and this is again the goal, to find something as early as possible before it even turns into a cancer. This is the way to go. It's going to be the most sensitive and the most specific, because they're just going to be removing any of the funky looking polyps, or all of the polyps technically, send them off for pathology, seeing if there's anything else going on. If they need to take a biopsy while they're in there of anything else, they can do that. So this is really just the best if you have the time and the basically time and resource, whether it's insurance coverage, financial, whatever. This is what I would recommend doing. This is probably what I would do for myself. We can get patients a cash pay one where we are for like $1,400 or $1,500. I know that can vary place to place, so I wouldn't take that to the bank and expect anyone else in another area to charge that price, but I'm just giving you an idea. So over, let's just say 10 years, it evens out to be, a pretty good investment in your health, I would say. Now let's talk about some of the cons. So obviously the prep is the thing people dread the most. You're not supposed to eat for a while beforehand. You either have to chug a bunch of polyethylene glycol or Miralax basically until your poop runs clear, and it just, don't make plans that day. It's not a day you're probably going to be planning to go into work. And then for the procedure day, obviously you have to think of, do you have to take off work for that if you're someone who's working? And then you're going to be under some sedation. You're not going to be under like full anesthesia where you have a tube in your throat and all that stuff. You're just going to be taking a really good nap. So you will need someone to drive you home after. So you'll have to have a few of those resources figured out when you're getting it set up. A couple things, if you're going to drink the Go Lightly, if you have a volume sensitivity, say you have kidney problems or heart failure or something like that, that could be something to consider. But nowadays you can talk to GI or whoever it is you're speaking with about pill options. Anecdotally, just don't know if they work as well, but I'm definitely not qualified to tell you that. This is just talking with patients over the years that I don't know if the pills seem to work as well or not. It probably depends on when you cut your diet out beforehand, and just, from personal experience being on this side of the camera looking at things during procedures, please don't eat corn. A good few days before you plan to get a colonoscopy. It does not digest well, it stays there, it gets in the way of the camera and the irrigation and suction, and just, anyways, avoid corn. That's all I'll say about that. So anyway, colonoscopy is going to be the most sensitive. About 95% of pre-cancer polyps or spots and cancerous ones are going to be found. They're going to be taken care of, and the specificity is pretty good with it too, around 90 or so % higher. So let's talk about the Cologuard next. Y'all probably seen commercials where it's just a little white box. It gets sent to your house. I don't really remember how the commercials go, to be honest, but it really is what it is. There's a really nice instruction manual that they send you with this box, and it walks you through the process, and it is super easy. The weirdest thing for people is just being like, oh wow, I have to poop in a box and send it off. That's not strange at all. Well, if you work in science labs or medicine, nah, it's not really. So it's going to be looking at stool-based DNA. And there's a couple different kinds of Cologuard. I'm not going to go into that right now because for most people it doesn't hugely matter one or the other. But if you put your stool sample in this bucket that comes with it, put the preserving liquid on top, send it off. Usually they give you a prepaid shipping label with it. Then a few days, week or so later, you'll get a positive or a negative result. If it's negative, you have pretty good likelihood that there's nothing too crazy going on. The sensitivity is a little lower than the colonoscopy, which is probably pretty obvious, in the lower 90%, around 93. Specificity, it is where it drops off. Any of these other tests I'm going to mention here throughout the rest of the video, it's going to be much less likely we're going to catch things earlier, and that will know truly what it is. So if you do get a positive result on a Cologuard test, we do recommend getting a diagnostic colonoscopy, so that way we can figure out, is it X, Y, or Z thing that is causing it. And thankfully, it is pretty good at detecting that. So most of my patients who've had some kind of positive test, it's been a polyp or something that they removed and sent off to pathology, and they went about their life good to go. The nice things, you can do it in the comfort of your home. You can do it a little bit on your watch, so it's a bit more convenient. You don't have to drink any of the yucky prep. Just don't send in a super watery stool sample because they might not have enough stool to actually do the test on it. I will say this only happened one time for me. The test order does expire, so even though there's no true time period you have to do it in or complete the test in, I think I had a patient who had an order open for over a year, maybe a year and a half, and finally they were just like, okay, this order is expired. You're gonna have to order him another one, or he's gonna have to do something else. And he and his lovely wife, we were both kind of nagging him, hey, get it done, put it in the bathroom so you'll remember to use it, things like that. And well, we got him taken care of, so y'all don't worry about him, but just, it does eventually expire. So as far as the sensitivity, I did mention the 90s percentage-wise, and other pros and cons for Cologuard. There's a couple types, and that is often more determined by insurance coverage if you do want to do cash pay, depending on the type of Cologuard, whether it's the regular or the Cologuard Plus, which is a little better. It could range from about $400 to $650 cash pay, but most insurers do cover it. So if you do have an insurance program or plan, then that covers preventative stuff. You should be good. If it's negative, you're good for 3 years, so quite a bit of a cut down. And then if it's positive, like I said, we will highly encourage you in a timely fashion to get a colonoscopy. Now I want to talk about FIT or IFOB. We have FIT predominantly in our clinic, but this one, it's stool-based testing. Again, it's not looking at DNA. It is actually looking at blood in the stool. And what often will happen is you'll get a kit, you will do your sample, you have a little stick. Ours comes in a little tube with a twisty top, and it has a small little scoop in it, and you go boop, 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 boop 6 times in the stool, put it back, send it off, or for some patients, bring it back to the clinic, and then we run it, and it's either, again, positive or negative, so you don't get like a true specific result, you just get a yes or a no. And if it's negative, you're good for 1 year. If it's positive, again, we will recommend doing a diagnostic colonoscopy to see what this is. I don't really recommend these a lot. These are those folks who really were trying to do the most health maintenance as possible on a budget. So cash pay at our clinic, you're thinking about $10, super reasonable. If you are somewhere else, who knows, it could be closer to $65 or so. I don't know because I don't work other places. But it is just looking at blood. As you might imagine, the sensitivity does go down and the specificity as well, because we're just not catching things as early as possible. And I have had a patient where his test was positive. We got him in for a colonoscopy, and brand new patient to me, never had a doctor before, at least not in at least a decade, and was just barely old enough to where I would have thought to screen him. No family history, no other red flag symptoms. So obviously we did the screen just to say, okay, here's an affordable way that we can test it positive, and he had stage 3, and now he's doing super well. So it is helpful, you can catch things. And I'm super thankful we got to do that for him in an initially affordable way. We got his other treatment stuff financially taken care of too. But if you really are balling on a budget, you could think about it. It's just, you'd have to do it every year, and it's not the best. The last I do want to talk about, I think we'll get more improved tests like this in the future, but right now it's not really there. It's something like a Guardant Shield blood test where we're checking for cell-free DNA, and I shouldn't say we because I don't work in these labs, but the labs are looking at cell-free DNA, and it's by a blood draw. So you do really get that convenience where you don't have to go back and get a test result, something like like a TB test, when if you've ever gotten one in the skin testing, it's okay, I don't have to poop in a box or on a stick or do some sedated procedure that has risk of anything like a procedure could with anesthesia and whatnot. But it's my least favorite right now, not because the concept is bad, but really just the numbers aren't there yet, especially for the cost. So it's not something, even though it was approved last July by the FDA, that's super well covered right now. One plan of Medicare covers it, and used to, one of the community care, like TRICARE, would cover it, but I don't believe they do right now anymore, and we're mid-August 2026. So it's financially a lot. It's about $1,400 or $1,500 cash pay. So if you think, well, if I'm going to pay that, I might as well get a colonoscopy. I agree. And then again, if you get a result, you don't know exactly like location or staging or anything like that, so you'd be recommended to get a colonoscopy. If, let's say, you're one of those lucky people where it's covered, you have access to getting the test because it's not just like a LabCorp request test. The company actually has to send a kit to the lab or to the clinic you're getting your blood drawn at and use their kit using their portal, which, whatever is fine. But it's just some barriers I think that will over time get improved. And yeah, the sensitivity's really not great. It's in like the 80s, mid 80s at best. And it's, as far as specificity, just the worst out of the four. I mean, Cologuard, I mentioned colonoscopy in the 90s, like 89 to 94%. The Cologuards, depends which one, but they're around 45%. The IFOB fit testing is about 23%. And then this blood test is like 13%. So if, again, you're really trying to catch something as early as possible and you have insurance coverage that would cover any of these other methods, I would probably go with it. If it is negative, I probably would not go with the blood test. I'm sorry, I may have misspoken a minute ago. But you know, if the convenience thing's nice. I have had one patient do it, and thankfully his was negative, so he's good for 3 years. But I think in the future, you know, I might change my mind as these improve, and I'm sure they will because of just how rapidly technology and stuff in medicine is progressing. So just some honorable mentions. If you do have these available to you, I'm not going to go into detail, but you can get, instead of a colonoscopy where it goes through the whole colon to the very end of the small intestine, you could consider a flexible sigmoidoscopy where it's just looking in the sigmoid colon. Obviously, it's going to leave out other parts of the colon and stuff. But if it's an option and you talk with the proceduralist and ends up being the best one for you or what you decide, that could be good for 5 years. There's also some CT with contrast testing imaging that you could do. I've never ordered it personally, but I'm sure that there's other folks out there in GI or oncology who maybe have done that as well. But anywho, I hope this was helpful. At the moment, I'm still like fan favorite colonoscopy just because you get the most bang for your buck and it's the best. And I'm in primary care, so I'm always pushing to catch things as early as possible, even if it's a polyp this big and they nip it in the bud and send it off and it's nothing. Well, great, but none of those other tests are going to catch it as likely as early as possible. Not 100%, you know, they still can. I've had them where a Cologuard's called a polyp before it invaded and turned into a cancer or anything like that, but just something to keep in mind. But I hope this was helpful. Drop comments below if you do have any suggestions for any videos. I've gotten one that I'm working on for alpha-gal syndrome, so I'm open to seeing if y'all have any other recommendations for topics that I, as a family medicine, lifestyle medicine physician, would be appropriately qualified to talk about. Bye, y'all.